Hello, my name's Dr. Melanie Stephens and I'm an Associate Professor in Adult Nursing at the University of Salford. I'd like to thank the International Skin Tears Advisory Panel for inviting us to speak on this important topic regarding skin tears in mammography. This work is as part of a collaborative research team from colleagues across adult nursing, mammography and radiography. So some background information. As you may well know, mammography is a crucial screening tool for the early detection of breast cancer. But like any diagnostic tool, it's not without risk of complication, and one of these risks are skin tears during the procedure. The procedure itself involves applying compression forces to the breast tissue, and this is to ensure high quality images are produced for effective diagnosis. The results in shearing and frictional forces, which can lead then on to the risk to skin damage caused by mammography are similar to those that create pressure ulcers. Pressure damage may appear as bruising and potential ulceration, friction damage resulting in a blister or blisters, and then skin tears. And this is from the breast sticking to the image receptor plate because it's moist, and then the distortion of the tissues when compression is applied, leading to shear forces. In the International Skin Tear Advisory Panel Toolkit, skin tears caused by medical devices also commonly reported complications include pain, skin reddening, tingling and bruising, but less reported complications include experiencing breast pain for days, the formation of hematomas and skin tears, and these may potentially affect compliance with future mammography appointments. So as a group of researchers who want to improve care and safety, it's really essential to understand the nature of discourse related to the prevention and management of skin tears in mammography. And there's currently a lack of published evidence around prevention and management of skin tears as a complication. So a narrative review was proposed to ensure that we could examine the information already available to develop our understanding of the topic and make a narrative review to summarise the literature on the topic was necessary, as it helps address more than one question and also completes a comprehensive summary of all the studies. We know there are criticisms of narrative reviews in regard to reliability, but we felt as a team that a critical narrative review can lead to new insights and justify future directions. And it allowed us to look at a breadth and depth of literature that you wouldn't normally see within perhaps a systematic review and meta-analysis, which only examines randomised controlled trials. So our question was, what is currently known about skin tears in mammography? So we conducted a comprehensive literature search with the support of our academic librarians in health and law, and then applied inclusion and exclusion criteria to the papers that we found. We actually chose 2002 as a date limiter, as this was the first time skin tears were mentioned in the National Health Service Cancer Screening Programme. And if you'd like to learn more about our literature searching process, please go and read our paper on the narrative review. 2 stages of screening were conducted. The first stage was screening all identified citations. So this includes initial examination of the titles and the abstracts and the removal of irrelevant material and of course removal of any duplicate records. The second stage was then examining the full text of the papers for compliance with the inclusion criteria. 3 members of our research team undertook the screening process, and this is to reduce bias, and 8 published sources were identified. We then had a group meeting as a group of researchers and we discussed the 8 papers, and 3 were then excluded. Again, please refer to our paper so you can see our reasons why. And all this process of searching and screening were reported using the preferred reporting items for systematic reviews and meta-analysis, just to map out the number of records identified, included and excluded, and the reasons for exclusions. And the final 5 papers were screened by all the team, and we created a data extraction table. The analysis then was the process of narrative review. So this is in order to map the literature, convey the depth and breadth of the field of study, provide reasons why the authors of the paper studied the topic in a particular way, the interpretations that were made, and the nature of the knowledge base and how it might inform future practice. Summarising the 5 papers included in this narrative review, you can see that 2 are from the United Kingdom and 3 from the United States of America. One was a book chapter, one was actually a piece of research, a research article, another was a company survey, another professional guidelines, and finally expert opinion. When we came to analyse the findings within each of the pieces of literature, we used the following themes: epidemiology, types of skin damage, definitions of skin damage from mammography, risk factors, the impact on patients undergoing mammography, and impact on practice. The first theme was epidemiology. So across 4 of the studies, there were 121 reported cases of pain, redness, bruising or skin tears post-mammogram. And of those 121 reported cases, skin tears were reported on 44 occasions. We know there are limitations with this narrative review. Each paper used different methodology to collect the data. So in the book chapter, it was based on case studies. In Nelson's study, there was pain scales and post-mammography events, and in Shonyo's study it was a patient survey conducted by a company. So this doesn't allow us to conduct a comparative analysis across the studies, but it did at least provide a narrative about the issue. So when we think of extrapolation of percentages of women who develop skin tears, from the survey in the USA by Shonyo, this led to an estimate calculation of 194,000 skin tears occurring annually across the 39.73 million mammograms taken. We feel that that's quite significant. And then we also applied Nelson et al.'s findings to the United Kingdom, where 2% of all women develop skin tears from mammographic screening. So in 2020 to 2021, there was 1.97 million mammograms taken. So this would equate to 3,940 skin tears. We know this is a limitation. They are crude estimations, but they do demonstrate the need for further research. Theme 2 was the types of skin damage and definitions of skin damage from mammography. So what we found is that skin tears were reported in 4 publications, but only 1 defined what was meant by a skin tear, utilising the International Skin Tear Advisory Panel's definition. Other types of skin damage were reported, such as abrasions, bruising, hematoma, intertrigo, redness and soreness. The third theme was risk factors, and a review of the available literature revealed a variety of risk factors which make women at risk of skin tears during or post mammography. The most frequently reported was the breast being stuck to the breastplate, which the authors from 3 of the papers felt was from damp skin. The second most frequent risk factor was redness and current skin damage or skin changes, which predisposes the individual to worsening of the current skin condition and susceptibility to skin tears post-mammography. The next highest reported risk factor was related to positioning technique and how the mammographers position and compress the breast. A really interesting observation from the Nelson study was that 3 women with a family history of breast cancer who underwent mammography developed skin tears were all reported as perimenopausal, so you wouldn't presume that they would have usual intrinsic or extrinsic risk factors. Other intrinsic risk factors are those that you would see in the literature as part of the International Skin Tears Advisory Panel guidance. However, we also noted that hormone levels appeared in one of the papers. Extrinsic factors did differ. So here, inexperienced mammographers using poor positioning and compression techniques, the use of steroids on the skin, and the risk of pulling away from the machine after compression by a woman, or a woman being unsteady on her feet during the mammographic procedure. Theme 4 is the impact on patients undergoing mammography, and we noted across the papers there was considerable impact. That less than half of the women contacted the imaging centre post-mammography to report their skin tear issue. This resulted in individuals feeling uncomfortable with significant fear and anxiety. We know from the surveys that individuals complained of pain during and after the mammography and felt the technologist was responsible. Women reported their complaints of pain was disregarded, and they actually noted they went unheard. And this has huge implications in the delay of future mammographic appointments, switching to another imaging centre, or deciding not to attend any future mammograms. On this slide, we just wanted to provide a qualitative comment from one of the case studies of the lived experience of a woman who developed a skin tear during a mammogram. And as you read it, and you can see that there was thoughts of pain, the lasting effect, the trauma, the actual skin damage, not reporting it to the mammographer initially, but then thinking about it and complaining, but thinking about their future impact should they attend future screening appointments, how anxious they're going to be about having a future mammogram. Theme 5 is then the impact on practice. So reviewing the 5 papers, we wanted to explore what advice was given to women to mitigate risks. So in one of the papers, there was discussions of history taking and examination of the breast before the procedure, ensuring proper documentation of the findings. In 2 papers, there was utilising correct positioning techniques of the individual for examination to avoid any complications. There was also a full and accurate documentation of skin tears, with compassionate communication with the client in the aftermath of any untoward complication occurring. In one of the papers, there was discussion around not backing out of the imaging equipment too quickly, and also the use of protective covers for the mammography plate. There was one suggestion that there should be a script for staff when dealing with a patient who reports a skin tear or skin damage. And then, importantly, a clear care plan and follow-up. In Shonyo's work in particular in the USA, staff talked about the impact on workflow, revenue and risk, and called this additional burden for filling out documentation, tending to an individual and their wound, and then arranging follow-up after a skin tear occurring. The impact of women switching from imaging centres affecting the revenue of the centre itself, and then women forgoing future imaging. There's also the impact on individuals and healthcare systems. In the United Kingdom, there's discussion about breast cancer going undetected. How do we then manage hard to position and challenging women during a procedure because they've got this significant anxiety from their previous experiences when skin injury and skin damage has occurred? And about informing a woman not to pull away from the procedure during or as soon as it's finished to reduce the risk of shear forces and skin tear damage. So in discussion, what we found from the 5 pieces of evidence is the extent and impact of skin tears following compression during a mammogram is really yet to be established. Future studies need to determine the prevalence of skin injury and skin tears and the impact on those affected, because we only found one comparative study and a lack of reporting of such events. We know from extrapolation of estimates that 2 to 4.75% of individuals who undergo mammograms are affected. As I say, we've got it in red there. This is a rough estimation because we also know there's differences in positioning and compression practices, symptomatic and screening surfaces, and also countries, and we should say the use of different equipment. So therefore our current evidence is limited in strength. only one paper had ethical approval. There was sponsorship bias, as one of the surveys was conducted by a company, and the other papers are expert opinion. So what are our recommendations going forward? Well, we feel that there's a new definition for skin tears in mammography, which is the development of a traumatic wound caused by mechanical forces, which then may include the presence of moisture and damp skin, and the severity may vary by depth and not extending through the subcutaneous layer. We know from across the literature there's emerging risk factors, so the breast being stuck to the imaging plate, positioning and compression of the breast during imaging, the technique and experience of the mammographer, and pulling away from the imaging receptor during or post mammogram. There are other risk factors not seen in the literature on skin tears in general, such as ageing, familial history and anxiety. And then commonly cited factors in the literature on skin tears have yet to be exposed in those that occur during mammograms. So documentation of past medical history, examination of the skin of the breast pre and post mammogram in the future could assist with this. The review of the literature also exposes significant fear and anxiety in those undergoing mammography. This may be caused by worry of familial history, stories from other women regarding the pain experienced during compression, and personal experiences of traumatic complications such as skin tears. But these publications reviewed have pointed to these detrimental implications. There is even cases, one McCare versus CML Healthcare, the account of a lawsuit in Canada where a client developed severe pain, hematoma and inflammatory carcinoma after a screening mammogram. And this leads to women not turning up for future mammography. We know that there's work to be done on regards to underbreast soreness as intertrigo, not explored within our narrative review, but this can impact on attending a mammogram, increasing the risk of skin tears during the mammogram, and also because of a lack of patient information and staff awareness, more education is needed on the treatment and management of underbreast soreness. We noticed there are no official guidelines on preventing complications related to compression in mammography. There is a chapter of a book, and this has now been created into the National Breast Imaging Academy e-learning module for mammographers. The International Skin Tear Advisory Panel definition and guidelines we recommend should include skin tears in mammography going forwards. And then there's a clear communication strategy of patient information, staff education, clinical guidelines and reporting systems to assist in examining the prevalence, the cost, the impact of skin tears and skin injury. Because the most important thing for us as a team of researchers is not only the care of women and their skin who are undergoing mammography, but the potential missed cancer diagnosis. So 10.8% of women reported they wouldn't return for a mammogram as a result of their skin tear. So if we think about the American figures, that equates to 19,400 women. So that is a significant amount. So thank you all for listening. Thank you to the International Skin Tear Advisory Panel for their kind invitation today, and I wish you all a happy global A World Without Skin Tears Day. Thank you very much.